This is Meru County, a pristine environment with rich vegetation and multifarious plantation parceled out through its boundaries. The leading county in horticulture production in Kenya, and yet its future generation was withering away as a result of mounting teenage pregnancies and other related gender-based violence cases. According to the Kenya Demographic and Health Survey report of 2022, Meru County recorded a staggering 24% of teenage pregnancies, a blinding statistic that called for a remedial measure commensurate to its thirsting adolescents and youth demands, thanks to their benevolent sponsors.
This project was focused on adolescent and youth, and we were looking at the indicators, or rather the data that we had received from the Kenya Demographic Health Survey 2022, which showed that about 24% of the adolescent girls and young women in Meru County had experienced teen pregnancy, dropped out of school, or had been experienced gender-based violence.
For instance, Joyce Gatwiri, not her real name, is just 17 years old and has already seen the worst of her tribulations, with sporadic school calendar for lack of fees, not to mention her family's struggles to put food on their table.
I'm 17 years old. Nilikuwa form 3. I'm a form 3 student. Mimi sikuwa napata school fees. Nilikuwa natumwa nyumbani nakaa for about 1 month. Nikirudi shule nakuta wengine wamesoma, inakaa sita wa captures. Sasa inabidi tu nikae nyumbani, mamangu hapati pesa, hakuna kazi yenye anafanya. Babangu mwenyewe hana kazi yake ni huko anaenda kupiga mawe. Akipata 100 anakuja ananunua unga ya tunapika chakula. Inakuwa ndio chakula nditoshi.
A beleaguered young girl with little hope surrendered her innocence to the prying eyes in exchange for her personal necessities, and her gullibility came with an unimaginable price.
Nilipotumwa school fees, nilienda, nikikuja mamangu hana pesa. Babangu hiyo wanapiga ndiye akipiga yezi pita 200. Akikuja akinunua chakula, unajua hiyo chakula tupo wengi sisi hadi itoshi. So unajua mimi venye nilikuwa stressed, mimi nilikasirika, mimi nikatoka hivyo. Kutoka hivyo hadi sijui mimi mali nililala, nilijikuta asubuhi. Kukaa about kufika December huko mwisho, mimi ndipo nilikuwa pregnancy.
Her unwanted pregnancy just added on to already inordinate worries. Her bumpy stomach would later become a laughingstock to her peers, and under the twilight of her dying hope, Gatwiri in retrospect cast her decision to elope from her parents' home.
Kuna vijana walikuja wakatuchukua, mimi hadi siwajui. My cousin alikuwa anajua, but unajua pia alikuwa tu hivyo. Tukaenda wakatupeleka sijui kwa pub, unaona, tukakunywa, hapo ndipo I get my pregnancy.
A few kilometers from her village slouches yet another young contemporary with almost matching tribulations. Joyce Queen, not her real name, is fighting an imbalanced life. At just 16, Joyce is carrying the weight of life she's never imagined.
Just few challenges faced me a lot while I'm school, but for now, I just got myself in this trouble, but it wasn't for my fault. Okay, just chenye kilifanya hapa niwe hivi. Nilikuwa nafukuza shule for many times. Nikakosa feels, nakuja nyumbani. Nakaa nyumbani almost 2 months bila kurudi shule. Nikirudi shule, nafukuza tena, narudi home tena. Naita wakati wa exam, nafanya exam na wengine. So hapa venye tu nilikuja home, hapa kwenda kurudi home, kwenda shule, nikirudi home ndivyo nilipata niko na ball. So accidentally sikujua what happened. Nilikuwa na boyfriend. Huyo tudi alikuwa ananisaidia na vitu vichache za shule. Kama mafuta ananibaia. Kama blow dry ananifanyia nywele. So for what najua mtu saa hii tuko kulingana na Kenyan economy vile iko. Kila kitu unachofanywa lazima utalipa. So I got myself niko na ball.
Lack of knowledge on reproductive health is indeed the biggest contributor to the surging numbers of teenage pregnancies in adolescents and youths. Husbanded by the stifling conditions, majority of young girls become regrettably impotent.
After my dad passed away, tulipitia like hatutaki tena. They don't want to see us anymore. Sijui kama hawakuwa wanatuona kama watu. Sasa mtu mwenye alikuwa anafanya tukae hapo, he's gone. Na sasa wanaona sasa they can do anything to us. Najua sasa tukaanza, they started treating us like tulichapwa, tulifukuzwa with nothing. My mom went through a lot. Najua anataka kututafutia at the same time. Unajua hata tembea na sisi everywhere anaenda. So tulikuwa tunaachwa tu hapo nyumbani.
The demise of her father brought with it yet another load on her family. A family that was a unit, stood ostracized, and her mother bore the brunt of the growing trends of gender-based violence in her modern community.
But when you also look at the issues of physical violence, Meru County, we stand at 36% against 34% at the national level. And that one makes me relate the issues that children go through. Because if we have unworking homes, if we have broken homes, children are left exposed and the community will take advantage of them.
With these blinding numbers and dimming rays of hope for the young and adolescent generation in Meru, different stakeholders domesticated a training guideline geared towards mitigating the downturn trend.
The role of the community health promoters was not only to create awareness, generate demand generation, but also, given that they are the ones that come in contact with these adolescent and youth in the communities, they are the ones that are able to report in case of gender-based violence, but also importantly, sensitize the community and especially the adolescent youth and young women on where they can access youth-friendly services.
We identified a very major gap on access of services. After we've given them the information on their light, there is the issue of where and how do they access these services. And one thing that stood out was that there were no youth-friendly centers specifically for the adolescent and youths to go.
A magic wand that changed the tide for a beleaguered community of young and adolescent girls that were once left forlorn under the chains of an invisible hold.
We have done a good number of trainings, like the health centers, the dispensaries, and even the sub-county hospitals and the bigger facility, the ETRH. We've trained around 160 healthcare providers on the matters of the youths. And let me say that it has had a good impact because they were able to get the knowledge on how to handle the adolescents and the youths, not like before.
Consequently, healthcare providers have now been greeted with the wherewithal necessary to handle the adolescent and youths, or better, the value clarification and attitude transformation training.
When the RHNK came, they came at the right time, and they assisted us especially to train our healthcare providers, whereby we started with the TOTs, the trainers of trainers. There were about 20 of them across the county. and we trickled down whereby we trained 60, the first bunch was 60 healthcare providers on the provision of adolescent and young people, SRH, that is sexual reproductive health services.
De-escalation of teenage pregnancies and the establishment of youth-friendly facilities parceled out in Meru County came as a stroke of genius to an already stifled community.
January this year, just looking at the data and going back to look at the records when we started the project more than a year ago, over 45,000 adolescent girls and young women in 11 sub-counties in Meru County had accessed youth-friendly services. And really this was attributed to the work that we had done in Meru County, with healthcare providers, but also the community sensitization.
With few and far between new reported cases within the county, not to mention the significant reduction of school dropout statistics, has radiated a thrilling gesture from different stakeholders, young and old generations alike.
So in a special way, I want to thank the Global Health Workforce Program for believing in Reproductive Health Network Kenya, Chase Africa and Mount Kenya Trust to implement this project, and we are really grateful that the adolescent girls and young women of Meru County were really able to benefit through your generous support. So thank you so much.
Meru County is slowly uncoupling itself from the chains of teenage pregnancies. And with the perforation of this guideline, youths and adolescent girls can smile again, hopeful that the clouds over their sky will rain again, this time for their good intentions.